Hey, it's a great day. Come take a ride with me. Here we go. One of the things that I like about talking to my colleagues this time of the year, we're in November right now, is one, the weather's great. It's a great day to go driving. But the other thing is that it's a great time to start planning for 2025. I just got done doing a lecture down in LA 2 days ago. And one of the things I started off with is I just love speaking in November. And one of the things I always mention to the doctors is it's time to start planning for the next year. So 2025 is coming up, less than 60 days away. And if you expect 2025 to be any better, then we've got to make plans now. If you do the same thing in 2025 as you did in 2024, then most likely you'll get the same thing you got in 24, hopefully, right? The winds are kind of against us as dentists, especially if you're in insurance practice, because the insurance companies aren't paying us more, they're actually paying us less. And with inflation even slowing, we know that the cost of doing business is going to continue to go up. And as the cost of doing business goes up, our profitability could decrease. So we want to make sure that we don't have to be focused on volume, but that we focus on quality over quantity. And I think that's what our patients deserve, right? They need our time. They need us to figure out exactly what their needs are. We individualize the plan, and then we treat them in the most conservative way as we can, like we would want our family to be treated. So I think it's really important for us to look at the services that we provide. What are the services that we could provide that we don't right now? What are the services that our patients are seeking out? And one of the quotes that I often remember is attributed to Wayne Gretzky, is that he would always skate to where the puck is going to be, not where the puck is. If you just skate to where the puck is, by the time you get there, it's gone. So one of the things we have to do in dentistry is we have to look at our industry. How have you been changing your target? How have your goals been growing? What steps have you been taking to achieve those goals? I think that's all really important. So during the last half of this year, as we've been putting out YouTube videos, we've been talking about equipment, the Endo Ultra, to make your root canals more successful, to clean out those canals better. If I were the patient having a root canal, I'd want to have my irrigating solutions to be copious and to be activated. So those are the things that we have to look at as clinicians. The pink wave curing light, I need to have my composite cure thoroughly, and I need to have it cure quickly. So I need a high intensity light, and that high intensity light better have all the wavelengths that I need to cure the resins that I'm curing. Some of the lights are of low intensity, and those are usually the cheaper ones. Some of them, the light guys don't collimate the light, so even if the light is gain out, you're losing it as it kind of dissipates in different directions. So those are the different things that we have to be looking at. Don't use cheap quality products. I will tell you, our adhesives that I've been talking about, we need to have bioactive adhesives, not a filling material that just fills a hole that we create in the tooth because we have to remove decay. But let's put something back in the tooth that actually helps the tooth heal up and prevents recurrent decay from occurring. Because again, if we're dealing with our family, we don't want to have recurrent decay around our restorations, whether it be a crown or direct restoration, a composite. So those are some of the things that we've been talking about, and I hope that you've taken some of this to heart. Some of the other pieces of equipment that I love to have in my office is my CBCT. Now I know CBCTs can cost a fair amount. Today you can get a really nice CBCT for about $50,000 at the end of the year with the Section 179. Now I'm not a tax expert, but you know that could be an incentive that would make it very affordable for you to acquire a piece of equipment. Now the CBCT is going to help you better diagnose a tooth that might need a root canal, but it also help you place more dental implants. I was one of those docs that I used to just use a PA and a pano, and today I can't imagine doing an implant without a CBCT, something that's three-dimensional. I think I place more implants. I think my patients understand the situation a lot better when they see their jaw and their head in 3 dimensions versus on a PA, something that's black and white and flat. Another great piece of equipment is a camera, either an intraoral camera, which is great, fast and easy to use to educate our patients, and another thing is just even a extraoral camera. Like I use my DSLR all day long. You know, it helps us to create photos so we can show patients. It helps us create photos that we can share with our lab. It makes me a better dentist because I can look at my work, and I look at my work from even years back to figure out, am I getting better? Are there materials that are holding up better than others? Because we don't remember those things. So a camera, education. I think one of the big things today is marketing. And when we market, we need to have photos. Social media, we have to post, because it's a visual that really attracts the patients. They don't know all the verbal things that we tell them. They don't know the terminology. So I think just having a picture is worth at least 1,000 words. So what I want you to think about as we finish out the last month and a half of 2024 is, what changes are you able to make? Maybe there's some investments we have to make, but make those investments wisely. If you buy something today that maybe makes your job a little bit easier, but it doesn't have a return, you have to consider those. Sometimes the high tech, even the scanners, and I have scanners, it does make your job easier. It does make you look a little bit more high tech in front of your patients, which I like. I like not having to use PVS, but one of the arguments, it depends on how many impressions you actually take in your office. Some offices are doing a lot of crowns and restorative work every day. So yeah, not having to pay for the impression material is a savings, and it does help the lab out in some cases. Other practices, when I talk to doctors, they're not doing a lot of crowns, and so the investment in an intraoral scanner, I don't know, may not be worth it. So I just want to say that each investment that you make in your practice, I think you have to make it wisely. You have to figure out if it's going to make sense for you. What I get bitten by all the time are the service contracts. You buy something that's maybe $50,000 thinking, okay, I'm going to make money doing that. But then the service contract's another $5,000, $6,000, $10,000 a year, and that I don't like. So again, look at all the costs. But I hope 2025 is a better year for you, and Vista Apex hopes 2025 is a better year for you. So start making your plans. Don't let 2025 be like 2024 if you don't like what 2024 has turned out to be. Let's have another great year, and I'm just going to go back to driving. So hit subscribe, be part of our community of like-minded individuals just trying to share ideas and make our profession better and provide a better service for our patients. All right, thank you very much. Enjoy the day.